Today, we're going to talk about something that I know is a huge worry for a lot of dog owners, intervertebral disc disease. You'll often hear it called IVDD.
You know, it's one of the scariest moments. Your dog is playing 1 minute, and the next they cry out, or you see their back legs just look off, unsteady. Those signs can point to a serious back problem. So let's break down exactly what's going on, who's most at risk, and most importantly, what you can do.
Okay, so let's dive right into the spine itself. To really get what IVDD is, you have to understand a little bit about your dog's back. So picture your dog's backbone. It's made up of a bunch of little bones called vertebrae. And tucked between each one of those bones is a special little cushion, an intervertebral disc. These guys are amazing. They act like little shock absorbers, letting the spine bend and twist and jump, all while protecting the super-sensitive spinal cord that runs through it. The best way to think about a healthy disc is to imagine a jelly donut. Seriously, it's got a tough, fibrous outside. That's the donut part. And inside, it has a soft, squishy, gel-like center. That's the jelly. But with a herniated disc, that tough outer layer gets damaged, and the jelly-like center literally bursts out. And because the spinal cord is trapped inside the bony spinal canal, when that disc material pushes on it, the cord has nowhere to go. It gets squeezed, and that compression is what causes all the trouble. The pain, the weakness, everything.
Now, this bursting out usually happens in two main ways. The first one is called a Hansen type 1 extrusion. This is where that jelly center becomes hard and brittle, almost like a rock, and then a sudden movement, like jumping off the couch, can cause it to shoot out and hit the spinal cord with force. This is the type we see most often in those long-backed breeds like Dachshunds. Then you've got Hansen type 2, a protrusion. This is a much slower, more gradual process. Think of it like a tire with a slow leak that's starting to bulge. Over time, the disc weakens and bulges out, causing a chronic, slow-burn compression. We tend to see this more in older, larger dogs.
And that brings us to the big question, right? Is my dog at risk? Let's talk about the factors.
Well, the biggest risk factor by far is breed. There's a group of breeds we call chondrodystrophic. It's a mouthful, I know, but it just means they're genetically built to have those characteristically short legs and long backs. We're talking about Dachshunds, of course, but also French bulldogs, beagles, shih tzus, a lot of very popular little dogs.
And when we say they're at a higher risk, we mean a much higher risk. Get this, Dachshunds are more than 12 times more likely to develop IVDD than other breeds. To put that into perspective, it's estimated that roughly 1 in every 4 Dachshunds will experience IVDD at some point in their life. That's huge.
But, and this is really important, it's not exclusively a small dog problem. We also see IVD in larger breeds like German Shepherds and Labs. For them, it's typically that slower, bulging type 2 disc disease that happens as part of the aging process, usually when they're between 6 and 8 years old. It's more of a wear and tear issue.
Okay, so this is maybe the most important part for you as an owner. What do you need to be watching for at home? Because catching this early makes all the difference.
The signs often happen in stages. Stage 1 is just pain. Your dog might have a hunched back, their belly might feel tense, or they suddenly won't jump on the bed anymore. If things get worse, you'll see weakness, what we call ataxia. This is that drunken sailor walk, where they're wobbly and unsteady, maybe scuffing their toenails. From there, it can progress to full-on paralysis, where they can't move their legs and might even lose control of their bladder. And the most severe stage, a true 5-alarm fire, is when they lose the ability to feel deep pain in their toes.
And I cannot stress this enough. The moment your dog cannot use their legs properly, it is an emergency. This is not a let's wait and see if it gets better by morning situation. You need to go to your vet or an emergency clinic immediately. Time is everything.
So, you're in the car, you're rushing to the vet, your mind is racing. Let's walk through what's going to happen so it feels a little less scary.
I know how stressful that visit is, but your vet team is immediately going to work. We're trying to figure out 3 things. Is this really a disc problem? If so, where in the spine is it? And exactly how bad is the damage?
It starts with a hands-on neurologic exam. We'll test reflexes and check for pain to narrow down the location of the problem. After that, we often take x-rays. Now, x-rays are great for looking at bones, and they can give us some clues, but they can't actually see the spinal cord or the disc itself.
For that, we need advanced imaging, like an MRI or CT scan. That's the only way to truly see the jelly pushing on the cord and confirm what's going on.
That's really why an MRI is considered the gold standard. It gives us this incredibly detailed picture of the soft tissues. We can see exactly where the compression is, how severe it is, and that's absolutely vital for making the right treatment plan, especially if surgery is on the table. Okay, so once we have that diagnosis, we pivot to treatment. And here's where the good news comes in. There's absolutely a path to recovery, and there is so much hope.
Generally, we go down one of two roads. For milder cases, where a dog is painful but still walking, we usually start with medical management. This means pain meds and anti-inflammatories, but the most important part, the non-negotiable part, is incredibly strict crate rest for 4 to 6 weeks. This gives the body a chance to heal. For more severe cases, especially with paralysis, surgery is often the best option. A surgeon will actually go in and remove the piece of disc that's compressing the spinal cord.
And here is that hope I was talking about. For dogs that go to surgery while they can still feel their toes, the success rate for getting them to walk again is over 90%. It's an incredible number. And it's exactly why we stress getting to the vet so quickly. It preserves that chance for a great outcome.
Life after IVDD is all about smart management. Recovery demands strict rest, usually for 6 to 8 weeks after surgery. Then, things like physical therapy and hydrotherapy can do wonders for rebuilding strength. Long-term, you'll want to focus on keeping your dog lean to reduce strain on their back and using things like ramps to prevent them from jumping. And for the dogs that don't get all their function back, mobility carts can give them an amazing, happy, active quality of life.
So we've covered a lot. If you remember only one single thing from all of this, what should it be?
It's this: time is absolutely critical. The clock starts ticking from that very first sign, the yelp, the wobble, the hesitation to jump. Getting your dog to a vet right away gives them the absolute best shot at a full recovery. Please don't wait.
Remember, this information is for educational purposes and is not a substitute for professional veterinary advice. If you have any concerns about your pet's health, please consult with your certified veterinarian. They are your best resource for ensuring your companion lives a long, happy, and healthy life.